Have you ever been in a healthcare situation and felt like, I don't know, your full story wasn't quite getting across?
Mm. Like something important about your actual experience was maybe missed.
Exactly. Well, today we're doing a deep dive into something that aims to bridge that gap. Patient-reported outcome measures, PROMs, and also PREMs, patient-reported experience measures.
Right. These are tools designed to get that direct feedback from patients, how they're feeling, functioning, what their care journey was actually like.
And the research, it shows they're incredibly valuable. We're talking better communication, smarter service use, even links to improved survival rates. Pretty powerful stuff.
Hugely powerful.
But, and this is the core of our deep dive today, getting these tools out of the research lab and into, the day-to-day reality of clinical practice. That's the real challenge.
It really is.
So we're going to unpack how something called implementation science offers a kind of roadmap. We're drawing on a great research paper looking at 4 case studies: Canada, Australia, the Netherlands, real-world examples.
And what's fascinating, it may be a bit surprising, is that even though PROMs and PREMs are well proven in studies, getting them adopted runs into surprisingly similar roadblocks across different places.
Okay, so same problems popping up again and again.
Very often, yes. But, and this is key, the solutions, the things that actually make it work, seem to need this very specific local tailoring. It's not one size fits all.
Interesting. Okay, let's start there then. What were those common roadblocks, the sticking points the research kept finding?
Well, a few big ones stood out consistently. First off, technology integration. Big surprise, right?
Huh. Always tech. So like the PROM system didn't talk to the main hospital system.
Exactly. Or the systems were just, clunky to use, required doctors or patients to have a whole separate login. Little things that create big friction.
Got it. What else?
Then there was clinician uncertainty. Doctors and nurses sometimes weren't sure how to, interpret the answers they got from patients on these forms.
Like what to actually do with the information.
Right. Or how to bring it up in a consultation without making the visit run super long. There were concerns about workload, about time.
That makes sense. Clinics are busy.
Definitely. And that ties into the next point. Workflow conflicts. Just fitting this new thing into already packed, established ways of doing things. Competing priorities.
So tech hurdles, clinicians' buy-in and know-how, and just fitting it into the daily grind.
Those are the main ones. We also saw sometimes issues like not having the resources ready to address the problems the PROMs actually uncovered.
Oh, right. Like identifying a need, but not having the service to meet it.
Precisely. And, less commonly, some worries about confidentiality.
Okay, that paints a clear picture of the challenges. So if the problems are often so similar, you'd think the fixes would be too. But you said that's where it gets interesting.
Exactly. That's the paradox. While the barriers felt universal, the enablers, the things that actually helped get PROMs and PREMs successfully implemented, were really specific to the local context.
So no magic bullet solution.
Not really, no. Success depended heavily on being flexible and tailoring the approach. Now, there were some common enablers, things that helped everywhere.
Like what?
Easy-to-use tech was definitely one. If the system was smooth and gave quick access to results, that helped a lot.
Makes sense. Remove the friction.
Right. And having support from opinion leaders, respected clinicians championing the change was important. Research funding helped, obviously.
Sure. But the really unique stuff came from the local level.
Yes, that's where the case study's shown. For example, in one Australian oncology clinic, they had a dedicated facilitator. This was a nurse who was also a trained scientist.
Oh, interesting. Like a dedicated support person.
Exactly.
Yeah.
Someone on site providing long-term help with the technology, the workflow, answering questions. That human support was apparently just as vital as the tech itself.
Wow. Okay.
And in Canada, a network of pain clinics actually developed a business case with the health system. They managed to get funds moved directly to the clinics to support the implementation work. Very practical.
So understanding the barriers and these specific local enablers allowed them to build strategies.
Precisely. Stage-specific strategies,
Right.
things you do before you start, like getting everyone on board, checking readiness. Then things you do during the rollout, like training, tech support. The intensity varied a lot there. And, crucially, things after launch.
Like checking in to see if it's still working.
Yes, ongoing support, but also using methods like audit and feedback. Basically showing teams data on how things are going, like completion rates for the PROMs.
Ah, using data to drive improvement.
Exactly. Which brings us to evaluation. how do you know if all this effort is actually making a difference?
Right. It's not just about launching it, but making sure it's effective.
And the paper makes a really important distinction here. You need to evaluate the innovation itself, like, is this tablet system even usable? But you also need to evaluate the implementation. How well are we actually getting this integrated?
Okay, can you give an example?
Sure. So for implementation feasibility, you wouldn't just pilot test a tablet. You'd measure something like the percentage of clinics that actually completed the training needed to use the PROM system effectively.
Got it. It's measuring the process of adoption, not just the tool itself.
Precisely. That careful data collection is key for knowing if you're succeeding, for monitoring, and for making adjustments along the way.
So wrapping this up, it sounds like implementation science provides a really useful lens for this PROM-PREM challenge.
It really does. Even if there isn't one single perfect framework, using these structured approaches, often combining different theories like normalization process theory.
Which helps understand how things become routine.
Yes, how they become just the normal way of working.
Yeah.
These approaches help make sense of why some implementations stick and others don't.
So the big takeaway for our listeners, bringing the patient's voice more directly into care via PROMs and PREMs is complex, sure, but it's definitely doable.
Absolutely. It just requires that dual focus.
Yeah.
Systematic planning for those common challenges, but also real creativity and flexibility to adapt to what works locally.
A blend of structure and adaptability.
You got it. And maybe a final thought for everyone listening. Think about this idea, universal problems versus context-specific solutions in other areas, maybe in your own work or even personal projects.
Where else could identifying those common hurdles, but then really digging into the specific local enablers lead to better, more sustained change?
Exactly. What could be normalized, made routine, more effectively if we really thought about both the why and the specific how of making it stick in that particular setting? Food for thought.